Thank you everyone for tuning in. I have Bonnie Solis here today. Bonnie is actually an Agents of Change employee. We're so happy to have her. And we are here for our part 3 of our series we've been talking about migrant youth mental health. And today we're going to switch gears a little bit and talk about advocacy, policy, and some work that we as clinicians can do to advocate for this population and also to empower this population to advocate for their rights as well. So we're happy to have you, Bonnie.
Happy to be here and give you all more information on this important topic.
Okay. Some of our housekeeping. My name is Megan Mitchell. I am a child and adolescent therapist in private practice. I'm the founder of Agents of Change Test Prep. Obviously, now we have moved into the continuing education space. I do many things. I'm also finishing up, I will say, my doctorate at SUNY Buffalo. And in that, I focus on technology, innovation, and multicultural supervision. So how do we incorporate cultural humility into supervision? How do we practice ways in which we can address our implicit bias? So that's a little bit about what I do, a very quick rundown. And Bonnie, I will actually let you tell us a little bit about your background.
Yes, of course. So I have my master's degree in social work from the University of Texas, Rio Grande Valley, and I'm also the social media and content manager for Agents of Change. My full-time position is a mental health clinician focused with migrant youth. So I'm here to share some information and insight on that because it is very important that we're well aware. It's something that we can all have clients in different populations that we serve, different agencies that we serve. So I'm definitely excited to share that information with you all.
Yes. And tell us, you're in a unique situation. Tell us where in Texas you are and how that affects the work that you do.
Yes, definitely. So I'm anywhere from like 30 to even 15 minutes away from the border. So it's something that I'm very exposed to, not only in the work environment, but also in the community. So it's something that I get to see day to day. And definitely working with this population and giving them the resources or services that they're needing is so important. As a social worker, they're needing these services, whether it's human resources or human services. So definitely just working with these populations and helping them out to reach their goals and making sure that they're in a safe environment is definitely very important.
Thank you. So she has firsthand experience and she lives in this community as well. So she not only has the professional experience, like she said, she's in the community, she sees it every day. So let's get our learning objectives out of the way. So we're going to touch on 3 things today. After this discussion, participants will be able to understand the emotional, psychological, and structural challenges faced by migrant youth, including pre-migration stressors, family separation, social exclusion, and barriers to resources. We definitely touched on this in parts 1 and 2, so we'll briefly cover it again. Participants will identify healthy coping mechanisms, the importance of social support networks, and foster critical thinking and a clear sense of purpose to help migrant youth navigate their challenges. We often talk a lot of the barriers, but we will talk about the protective factors. This population has proven to be very resilient, and how do we tap into that resiliency that this population has? And then we're gonna get more into the macro discussion, and we're going to talk about building awareness for federal and state efforts to protect migrant children. Even if you're not really tuned into political stuff, it's really important that there are some key issues, some key bills, some key legislation coming out that affects migrant youth, immigrants, and we'll briefly touch on that. And I will share that that came from an NASW toolkit, which is really cool that they have put information out specifically about how we can get involved as social workers. So those are our 3 objectives for today. And I guess, Bonnie, you and I can kind of get into this discussion. So we'll go through, we've talked about this, but I'll touch on it and then I'll ask you how you see this in your work with migrant youth. So we know that there's a lot of challenges faced by immigrants, migrant youth coming across newcomers. And one is the emotional and psychological strain. So some things here might be separated from family or support network, feeling excluded, isolated, and we talked about feeling pressures to acculturate. Um, Also, something we haven't touched on too much, but there was most likely stressors going on in their home environment prior. This could be poverty, civil unrest. There's most likely a reason as to why they are coming over to the United States. So, what are some of these different factors or these different stressors that you see in the work that you do with your clients?
Yeah, so I think working with youth is so important because they're developing so fast, and they don't understand what their emotions are. What is it that they're feeling, and putting words to that. So as mental health clinicians or social workers, we need to kind of step back into a child's position, and see eye to eye with them, and understanding that we might have to explain these emotions to them. We might have to explain their situation to them in order for them to kind of put into words what is it that they're feeling. Um, and understanding that they might be in shock. Of course, they might be nervous or fearful to share information with us. So definitely keeping all of that in mind. But they are definitely going to be dealing with family separation, of the change in environment that they're coming from, and now going to be in. The services that are being provided, whether you're in a school, whether you're in an agency, nonprofit, or in a clinical office setting, hospital setting, anywhere that you're at, you can interact with these individuals, and just making sure that you understand where they're coming from. Some of the stressors can definitely be poverty. So even very basics, maybe not being able to know how to use a water fountain, knowing how to turn on a sink. And you might see these things, or they might ask you questions in regards to these very basic services or resources.
In your experience in the specific populations that you work with, what are some of the reasons why they would be migrating to the United States? Is it that they are seeking freedom here? What are some of the different, I'm sure it's on a case by case basis, but what are some of the reasons why someone might be appearing for services here in the United States?
A lot of the children share that they're here for educational reasons, for more successful future.
Yeah.
So that is a majority of the reason why the youth travel over here. Secondary is definitely safety, whether they're put at risk or threatened, to join a gang or join something or do something for another association or group in their community, as well as politics and the
Yep.
things that are going on, and the freedom of being able to do very basic things in their community, or safety of just walking just outside of the house for different reasons, whether it's threats or political reasons.
I can imagine once they are here, that can be very jarring to have some of these basic rights that they might not have experienced before and just understand. I could imagine there might be fear or confusion or a lot of trauma around, is this okay? Is this not okay? Do you see that too? And a lot of taking time to get used to the way things are here?
Yes, definitely. There's a very big difference, even in communication. So just understanding where they're coming from and being patient with them to be able to explain um, some things that are normal here, but also understand that, there may be a difference. So whether they're taking things wrong from another child, or, making sure that they're feeling comfortable in your office as well. So definitely seeing the differences of that and making sure that they're safe and comfortable.
So the next one here is structural barriers. This is, I think it kind of taps into what you were talking about, Bonnie, about those basic needs. So we're talking about here material resources. So that could be clothing, food, shelter, legal challenges. We know that that is a big thing too. Do they have legal representation? Do they have access to legal representation? Unstable housing. They might not have any control over where they are housed or where the government or where resources are placing them, healthcare, education, and social services. And then this is a huge one that we've talked about, language barriers, right? I would assume where you're at, there's probably more access to bilingual services and services can be provided in multiple languages, but that might not be the case everywhere. So what are given the list here, what are some structural barriers that you see with the clients that you work with?
Yes, definitely language barriers can be a very big one. But as Megan mentioned, it does depend on your area, and the services or languages that people have access to in your area. But of course, knowing a hotline or service that you can provide that service to them and making sure that we're culturally competent in providing the service correctly, not just through Google Translate. Yeah, so definitely making sure that we're using a professional translator.
Hmm.
But the amazing thing about these structural barriers that they might be experiencing is that we can be in all of these settings as social workers, as clinicians. We can be in, the legal aspect, not necessarily as lawyer or anything like that, but maybe like pro bar services, or working in an attorney's office or working in a court system as a social worker, as a counselor, and providing those services. As far as housing as well, providing those services to them, and healthcare, we see social workers in clinics or in hospitals, education, we see them in the school system as well. So definitely being there for these clients, and providing them the resources that they need. So in a legal setting, you might be in a school setting or a hospital setting and know that they need these legal services. So educating them, hey, these are the community services in our area. Here are these other services that you can have. Housing, of course, just giving them those resources of information, whether you're there to help them out in setting those resources up, or if your agency doesn't allow that. As social workers, we're here to provide the resource of the number, of the address of services that they can have access to. So definitely helping them out in that way to continue succeeding.
And that's where our abilities as case managers and brokering of services comes in to play here, right? We build these networking connections. So I'm sure, Bonnie, within your community, who someone is that you trust as a referral source. So building those connections, networking, and this is outside of the profession. This might be a doctor, or this could be a nonprofit. So it's really important that we build those connections because sometimes we are limited in our scope of what we can do. One that I think is really important is that undocumented immigrants are in a very vulnerable spot. So I feel like they feel as if they are maybe tiptoeing around a lot of different things. They might experience toxic stress. We know that depending on what their story was prior to coming to the United States, their current, they could have just been exposed to stress on a daily basis. Anxiety over deportation. Will I be deported back? Will a family member be deported back? And then limited access or not knowing that there's access to healthcare legal aid makes it even more difficult. So how do you see in your work this vulnerability or this feeling really not settled in their status here in the United States?
I think in a work setting, definitely seeing it as a fear of those extra services that we're offering, whether it's a
Yeah.
resource or within our own agency, of saying, like, there's these extra support or extra help that you can have during or after our services. And it's always a question of, well, if I fill out this information, where is this going to? So definitely just educating your clients on, where the information is going to, where the information of your documentation is being saved, to reassure them of the services that you're providing and the services that you're referring them to as well, to make them feel more safe. But as I mentioned as well, just being in a community near the border as well, I see it as simple as just the fear of driving, the
Yeah.
fear of, being stopped to get a ticket, but then of course you're providing your information. So a lot of it is providing personal information and where that's going to be saved, or who's going to have access to that, that they might be on the radar now.
Yeah, and I can imagine that for some that might make them more isolated, right? I'm just going to keep to myself. I don't want to put my information out there. Which is definitely understandable, right? Like I'm going to just not put myself out there because that could lead to more attention or that fearfulness or that anxiety.
And definitely working with children, if you're looking for family members to care for them, or looking for whether this might be CPS or other like reunification services, um, understanding that these families might not be willing to share this
Yeah.
information and how that affects your client in reunifying with these individuals. Because then you also deal with not feeling unwanted because they're unwilling to provide their information.
Yeah. So we've talked, this is kind of a summary of the first two parts that we did. Now we're going to talk about the resilience. We know that this population can be incredibly resilient, and we don't want to just focus on some of the barriers. We want to be strengths based. So this is something I know that you've talked about a lot in the work that you do with kiddos and adolescents, is healthy coping mechanisms. So helping this population develop strategies to manage stress. They might have physical responses. We know there's a lot of nervous system stuff going on. They might have emotional responses, but there's a lot of coping that has to be done when there's such a new situation like that. So that's the work that Bonnie does. She's talked about it, right? You said that it really depends on what each kiddo needs, but you've said you've done like different group stuff and different things, and it really, this is really the clinical aspect of making sure that our clients have those healthy coping mechanisms. So we've talked about that. I'd be curious, Bonnie, how do you help your clients build social networking? So we've talked about some ways that they might feel isolated, but we know that community support, family support, social support, especially with kiddos, peer support can really be a protective factor. They want to feel that they belong. So how do you and your agency help build that social support and build that social connection?
Definitely working on communication skills, breaking that language barrier or bringing that confidence. I think a lot of it is working on confidence as well. As children, you might see them looking down at the floor, or even putting their head down. So you want to help build their confidence is a very big one. And from there, just build on knowing and being understanding of other cultures and other religions, and understanding that your friends or your families are here to respect your values, your religion, and your cultural traditions, but understanding that people are going to practice different things
Yeah.
and you can still be friends with these individuals. So definitely just educating the children on those things. Do you get along with these individuals playing soccer? Do you get along with them in like a math club or something, and understanding that you're going to have differences in other areas, but it's okay. As long as everyone's respectful in the other aspects that they might have differences, then it's okay to be friends with them and have that family support system as well.
Do you find for some of your clients this is a big culture shock? Because I could imagine where they're coming from. They've never met someone outside of their religion or their social class. So even as someone, I grew up in a suburb where it was very, very homogeneous. Everyone looked the same. Everyone, practiced the same religion. So do you experience some of that where this is the first time they're being too exposed from people from different backgrounds?
Yes, definitely. And it comes down to very simple things as well. I know the kids have even mentioned differences in just like eating habits, or
Mhm.
maybe tossing the food. The big thing for them is that, oh, in America, you guys toss all your food away. And, why
Yeah.
would you do such a thing? And of course, I do educate them on the reasons why, or, your opportunity to share, but also being safe. And during this time, that COVID just passed, We don't want to be sharing with other kids. So definitely just kind of knowing and understanding the time as well as the culture of differences. So it can be something very simple as food, and then others as well. I teach them about um, not only like cultural reasons as to why someone may practice something, but also just being vegan or vegetarian, and practicing different types of diets, and respecting those things from those individuals is a choice that they have, and being understanding of it.
Yeah, I can also so I know we talked about food being one. Do you see sometimes that having conversations around like I know there can be very vastly different ideas around medical care and when you go to see a doctor or you just do it on your own, do you have to have those discussions too of like here's some, there's a dentist you see and I know in other cultures they're more like we take care of it ourselves and we might do more traditional medicine practices.
Yes, definitely. That can be something that they have to get used to, especially just coming into the country. They do have to get all their vaccines. And as kids, practicing those things is very difficult. Going to the dentist, going to the doctor, and knowing that, what is it that's going on with their body and being able to ask those questions. So, of course, as case managers or clinicians, counselors, just giving them that confidence to be able to understand their own body and communicate with these medical professionals of the questions that they have.
And then our last strategy we're going to talk on is critical thinking and purpose. We need, as human beings, we need critical thinking skills because when we're faced with a problem, we want to have the skills to problem solve, right? And that's a big part of growing up. So I do that a lot in my work too, is just like, hey, here's some resiliency skills. Here's how we can practice flexible thinking. But I also think having a sense of purpose, right? Like you said, maybe it's soccer that really drives them, or maybe it is being involved in science, right? So tell me a little bit about how you see giving problem solving skills, helping them work through problems, conflicts, a variety of different things that might come up, and helping them find their purpose when they're here. How do you do that? How do you see that play out in your work?
As a clinician, I think it's definitely very important to connect with your client and what their interests are, and their motivations are, right? So having that conversation with the children and knowing, like, as far as age group, is it a worksheet that's going to help? Is it having the conversation? Is it doing like a physical activity with them? Depending on how much access you have to the child, is understanding. Like, if you're in a school setting, you're definitely going to see them in very different environments, so being able to speak to the teachers, being able to speak to their coaches and seeing like their interest, and kind of gearing their communication skills or the problem solving skills into their interests, because there's a lot of ways that you can work with these children, or any children, and putting their interest into a session and building their confidence as well.
So we talked about some of the barriers, some of the resilience strategies. Now we're going to switch gears and talk about advocacy. And this, we know that in social work, it's embedded in our code of ethics and other helping professions that advocacy is really important. Bonnie and I both work at the clinical level, but our work is never just clinical, right? Our clients exist in systems. So there's meso work, there's macro work that has to be done. So we're going to switch gears and talk a little bit about advocacy, policy, some of that um, higher level discussion that a lot of us maybe are not familiar with as clinicians, but it is so important and it needs to be integrated into the work that we do. So this is, I like this image. I'm just going to touch on these different things. This is from the Journal of Human Rights and Social Work, and it's just giving tips and ways that social workers can help support immigration. So I'll read it, and then Bonnie, if you want to just kind of touch on anything that sticks out for you. Provide mental health resources. Obviously, you've been talking about that. That could include a variety of different things. That can be the clinical services. That can be, getting them in a group, or it doesn't necessarily have to just look like therapy. There's a variety of ways that we can help people with their mental health and provide resources there. Advocating for immigrant students, that would probably be whatever setting you're in, but if you're in a school or you're in some sort of agency that interfaces with students, that would be really important. When I worked in DC, that was a big area, is providing support to them, especially in the special education system. It's a very complicated system as it is. So providing advocates, providing information in their home language, there was a lot of different ways that we could support students who have just come into the United States. For, I know we're talking about kids, but they go into the adults at some time, right? They transition into adulthood. So fostering job and career development. Okay, once you become 18, what do? You leave school, and then where do you go out and do in the workforce, or what are your career aspirations? Informing immigrants about their legal rights. This is oftentimes, maybe they're unfamiliar, or that there's that level of fearfulness, right? There are rights. That doesn't necessarily mean everyone will respect those rights, right? But there are legal rights that immigrants have. And then we've talked about this wraparound services, access to resources for food, healthcare, and housing. So Bonnie, do any of these stick out to you that you're like, well, I'm sure you do all of these things on a day-to-day, but do any of these stick out to you, or any reflections on this?
I would say definitely all of them. And another one, or a big one for me, is education. So definitely like you being here to listen to this CEU is so important, to be educated on it as well. So that's another way that you can support the population. Um, but as far as providing mental health resources, it's something that, we can provide, whether it's you yourself that can provide the service
Mhm.
or referral. Advocating, this can be speaking to your local, um, Senate, or, going to your capital if you're nearby, being able to lobby for these clients, speaking to your city and seeing the changes that you need in your agency for this population, or the populations that you serve, and speaking up for them and advocating for them. Of course, fostering job and career development is so important for them to understand, their rights.
Yeah.
The basic and bare minimum of minimum wage that they can be paid is so, so, so important. Educating them on trafficking to avoid, these incidents occurring, providing them the resource and hotline numbers for them to report these incidents if it is to occur. So, of course, even if they're not at that level of being an adult, educating youth as well, that these are their rights once they do start their career or a job, and knowing that these other individuals that are providing the job to them are respecting their rights, and of course at a legal level as well, jumping into that, as clinicians, case managers, or social workers, we can provide those resources. Um,
And like we talked about, we are not lawyers outside our scope, but there are immigration lawyers. There are people that specifically focus on this. There's people that will do this for pro bono. So making sure that even if you do not necessarily, this is not the major population that you work with, it's important that you connect within your network so you know who is the person that I would refer to should I need this service. Okay. So we're not going to get into the nitty gritty here, but I myself was educating myself on some of these as I was preparing to have this conversation with Bonnie. It, you can say I don't really follow up on politics, but these are just important policies and acts that you need to know about because they do have an effect on the clients that we serve. And I always say social work is political, right? It doesn't necessarily mean you got to get into, the head to head about politics, but what does government do? They pass laws and bills. So you need to understand of not only what is being passed, but the political climate and where you're at, right? Because we know that depending on who's in office, that can change a lot of different things. So one, I'm going to go through about four or five different federal and state efforts that are out there um, to protect child migrants. The first is Keeping Families Together Act, and why this exists is to limit the separation of families at or near points of entry. big topic in the news cycle, right? Children being separated from their family members, and there has been a lot of advocacy for social workers, helping professionals that we know that developmentally and from an attachment standpoint, it's so important for young children to be with their families. Bonnie, do you see any, not the specific law, but how do you see this play out in children coming over and being separated from their families or being separated from family members, siblings?
Yeah, they're definitely affected in so many ways. But just to share on that is just you might work in the foster care system and see that, there might be a reason as to the parents or caregivers doing something wrong in order for them to be separated, right? In these cases, it's being separated for other reasons. Of course, it goes into legal things, but it's affecting the children in not understanding or being prepared for these things. So being there as a case manager, clinician, and social worker and providing the services that they need to emotionally be able to deal with this process and work through it until they can be together or, be with another family member and be in a safe environment.
And this just reminds me, if we're going back to the code of ethics, the dignity and worth of the person, right? I think what we're going to go through with some of these federal and state efforts is there's been a lot of discussion and a lot of awareness of, at the very basic, providing humane conditions to children and families when they come over, which the next act is Stop Cruelty to Migrant Children Act. And we've talked about this, wanting to end the separation, strengthen health and safety protections, right? There's been a lot of discussion around, are the conditions safe? Is it, from a health standpoint, is it healthy for them to be in these conditions? And making sure that government funds are used in appropriate ways to support this population. And how can you stay active in both of these things? You can, of course, express your support. You can follow up. You can research this on your own. And a lot of different agencies that are policy focused, so that might be a think tank or a nonprofit, they'll put out alerts or they'll put out different briefings so you can stay aware that way. I'm sure, Bonnie, your agency has to stay aware of what is going on with the policies, and because they can change also from time to time as well. And they might change and you're like, I didn't even realize that this was passed into law or that this is on the table for voting. So that's the first two. Our next one here is U.S. Border. What does that say under there? U.S. Border Patrol Medical Screening Standards Act. Medical screenings, and you've talked about this, that when they come through, there is medical screenings that need to happen. Tell us a little bit more about, from your perspective, Bonnie, what medical screenings or medical services that you've seen that your clients undergo when they come into the United States.
Yes, so definitely seeing them go through a very general checkup or basic checkup, eye exam, making sure like physically nothing's hurting them, or they have any abrasions, especially from their travel that they might have just endured, their nutrition or malnutrition that they might have had due to the travel, and then of course having them get their vaccines and educating them on those services that they're being provided is definitely so important. But it's important for not only for the client but for ourselves as well in making sure that we're keeping ourselves and our community safe. So
Yeah.
just well-rounded all the way for medical services.
And we didn't touch on this, but it's important. Yes, you can advocate for support for these bills. Of course, you can go you can write your constituents, you can do different things. But also, I think a big thing is advocating for trauma-informed services, because we as social workers and mental health professionals, we have this lens of, we want to always come from a place of trauma-informed care. But that might not be the case, right, with medical screenings, and it could feel very violating or traumatic for some clients. So always thinking about, how can we ensure that services that are provided are trauma informed, and if they're not, we might have to process that with a client, right? Like that could be a very negative experience that they had, and they're I don't understand why I had to derobe or have to do these different things in front of a medical professional. So just things to think about as we are working with this population and processing their experience of coming over as well. The next one is the Strategic and Humane Southern Border Migrant Response Act. And so we know that there's a lot of discussion around the southern border. That's where Bonnie is at. But this bill basically talks about how can immigrants come in the southern border and how can we respond in humane ways. So these all kind of get to the crux of how can we provide that dignity and worth of the person? How can we make sure there's safety? How can we make sure that it's done so in a humane manner, in a humane way? Any thoughts on either of these, Bonnie?
Definitely just educating your client. As Megan mentioned, these laws change, rapidly, or, they change within any matter of time, right? And just as we might miss some of these things passing or some of these things changing, these children or clients might miss it as well or not understand what the changes are. And they might have had a sibling or another family member travel previously, and they're wanting the same process to occur. So they're questioning, like, what is it that's going on, and how come this happened that way or this way? So definitely just being able to educate them and having them understand that changes happen, or referring them to those legal services if it does come to that point where it's more legal information.
Right, that their rights were violated. There are people out there that could represent them or help point them in the right direction because like I said, we're not litigators, we're not in the legal realm that way. We are more in the helping professional, but we can point them in the direction of those people that do have that expertise and that knowledge there.
Yes.
So before we wrap up, Bonnie, I know that you had the opportunity to participate in some advocacy earlier this year. So I just wanted to you to kind of tell us about what you did on that day. When you went to the cap, did you go to the Capitol?
I have gone in previous years. Yes. So maybe with your school, if you're still a student, seeing if your school's going. That's how I've attended before. I've also attended with my work. In advocating for your clients, it's not only working with migrants, but advocating for your clients. I've also attended with NASW.
Mhm.
So definitely just there's so many ways to get in and advocate for your clients or advocate for your community and the changes that you need in your area. And if you're not able to make that trip and physically be there in person, there is ways to speak to
Yeah.
your representative in writing a letter or maybe going to their office. That might be a closer trip for you. But that is definitely a way that we can advocate for the clients or community that we serve.
So I have not been to one of these like advocacy days or days where you're able to go. What is it like? What is some of the advocacy work that you're doing?
So there's definitely a lot of preparation that has to go into it and understanding like where you have to go. There's a lot of offices, there's
Yeah.
a lot of people. It's very interesting to go on advocacy day with social workers because you have other social workers from around the state attending with you as well. But definitely just being prepared. You can write a letter in advance and make an appointment in
Mhm.
advance prior to the day of so that you are there in person and you have your set time to go and speak with your representatives. So definitely preparing in that way, and preparing, your points because you want to respect their time. They have other things and meetings and of course bills to be passed. So they might step out. So just definitely having your point set in the community or population that you're serving and changes that you're needing and as to why. And maybe having someone do that research for
Yeah.
numbers, definitely doing the research as far as like numbers and reasons as to why you're
Yeah.
needing these services in your community and the difference that it will make if this put in place. And that can be as simple as I know in our community we've had social workers advocate for flooding,
Mm.
which is so different like in my mind, but we can make a difference in our community in so many ways, whether it's this population or other populations.
And that's where our persuasion skills come in, right? Like we have a short amount of time with a lawmaker or an elected official, and you're not going to get to like, sit and have a 3 hour conversation. You might get 10 minutes in front of this person. So not only how can you persuade them, but how do you take all this information that's out there we see on a day to day and make it stick and hit with the elected officials? When you went this year, what were some of the efforts that you were trying to advocate for?
So for that, it's definitely just making a change in our community as far as like services being provided, and making sure that we have enough resources. So in our area, we don't have enough services being provided as far as like locations and agencies. So definitely just speaking on funding, and speaking on how are we going to provide the services that is in, indefinite need, in our area.
And that kind of brings me back to when I took my community organizing class way back when. And there's funds. And how do we convince those people in power to allocate funds to things that we know are so needed, but there's not an unlimited budget. And we have to think about there's conflicting priorities, and how do we get the message out there that, hey, this is very important and here's the information as to why it's important. Like you said, like there's, limited access to resources, and I'm sure you guys came with lots of points and how this would affect it. And so this is when we both are clinicians, but we have to do this work and we have to advocate for what's just beyond the client in the room with us. I like to say that sometimes like you can do the best therapeutic work, but they live in systems, and sometimes the more impactful work is working on the policies or working towards or at least advocating for those different levels of service, because we can do the best clinical work, but if they're up against policies and laws that don't support them, we're kind of stuck. So I guess my last question for you, Bonnie, is yes, you are a mental health clinician. Yes, I do clinical work. How do you use your meso and macro skills outside of just the clinical work that you do with clients?
So definitely networking and like fighting and advocating for, the things that your client needs or that your community needs, We have our jobs, but you can always step out of that. So working with other agencies, things that find that you have interest in is definitely so important to network with those individuals. Even getting into like coalitions in your community is something very local, or starting a coalition within your agency if that's something a need that you need or haven't thought of, and making that change there.
And I agree. It doesn't have to be on a national level. You can get involved. There are neighborhood advisories. There are different ways that you can, and there's no way that's right or wrong. I just did a conversation with someone that works in more of the policy realm, and he said there's no wrong way to advocate. And I loved that, right? There really is not. If you have the best intentions of your clients in mind. So get involved in way and in things that you're passionate about. It does not have to be, something that you do day to day, right? You could still be, like you said, flooding or clean water access or the environment, right? It could just be something that is of interest to you, and you can get involved in that way. So that will be my last point of advice is there's no wrong way to advocate, but you do have to be aware and you do have to advocate for your clients, because that is really at the crux of what we do as helping professionals. Okay, if you are interested in where we got this information, here are the key resources. What's really cool is that the NASW actually put out a brief, a toolkit on immigration, and I do believe we're headed in the right direction. There's a lot of articles out there about how social workers can get involved in this. There's immigration social workers. There's lots of different programs that are specifically focused on these different specific populations and the specific skills and work that would need to be done there. And of course, Bonnie, I want to thank you for your time. I think this part 3 was a really nice way to round out the conversations that we've been having and how we can tie it all together and move to some of that more meso and macro advocacy.
Yes, definitely. And thank you all for joining and making the difference and just being part of this training. You're already starting to make the difference in that way. So thank you all so much.
Thank you, everyone. If you are going to earn your CEs, make sure that you fill out the post-test and you fill out the evaluation so that you can earn your CE credits for this. And remember, this is a 3-part series. They all can be done individually, but of course, we encourage you to do all 3 parts to get a really nice, deep understanding of working with migrant youth. So thank you for tuning in, and thank you, Bonnie, for your time.
Thank you.
I hope you enjoyed this continuing education course from Agents of Change. Want to earn your CE credits for this course? Visit agentsofchangetraining.com or the link in the description to purchase the course and take the post-test. If you're looking for more CEs, check out our unlimited plan. You will get unlimited access to 150 plus ASWB and NBCC approved continuing education courses for one low annual fee. We're always adding new courses. Did I mention we also have 5 free CE credits available too? Check it out at agentsofchangetraining.com.